An emergency room, ER, also known as an emergency department, ED, or casualty department, is a medical facility designed to provide immediate emergency care to individuals with acute injuries or illnesses. Here is an overview of how an emergency room typically works. Triage. Upon arrival at the ER, patients are assessed through a process called triage. Triage involves quickly evaluating the severity of a patient's condition to prioritize care based on the urgency of medical needs. Patients with life-threatening conditions or severe injuries are seen first, while those with less urgent issues may have to wait longer. Registration. After triage, patients or their accompanying individuals are usually required to complete a registration process. This involves providing basic personal and insurance information. Medical evaluation. Once registered, patients are taken to an examination area where a healthcare provider, often a nurse or physician's assistant, performs a more thorough medical evaluation. Diagnostic tests, such as blood tests, X-rays, or other imaging studies, may be ordered to help determine the nature and severity of the medical problem. Treatment. Based on the assessment and diagnostic results, appropriate medical interventions are initiated. This may include administering medications, setting fractures, stitching wounds, or other necessary procedures. Emergency room staff is trained to handle a wide range of medical emergencies, from trauma cases to acute illnesses. Monitoring. Patients may be monitored closely, especially if they require ongoing care or observation. This monitoring ensures that their condition remains stable or improves over time. Consultation with specialists. If necessary, emergency room physicians may consult with specialists to provide more specialized care. For example, a surgeon may be consulted for severe injuries or a cardiologist for chest pain. Admission or discharge. Depending on the severity of the condition, patients may be admitted to the hospital for further treatment and observation, or they may be discharged with instructions for follow-up care. Follow-up and referrals. Patients are often provided with instructions for follow-up care and may be referred to a primary care physician or specialist for ongoing treatment. If the condition is critical or requires specialized care, the patient may be transferred to another facility with the necessary expertise and resources. It's important to note that emergency rooms are designed to handle true emergencies. For non-emergent issues or routine health care, individuals are encouraged to seek care from primary care providers or urgent care centers to avoid unnecessary strain on emergency services.